today we are talking about medico-legal issues in assisted reproduction and why we need this, because we need to have clear, consistent legal framework to govern ART practices. We should have regulations so that we can do it ethically, and one should have a legal, psychological, and a medical counseling for the patients who need ART. And that is why this act, which was so much needed, appeared in January 22 with a lot of rigorous changes and coming to Parliament and then becoming a law now finally, so that we now have the legal framework. Because there are many worldwide, there are many cases, legal cases due to severe IVF incidents. And even in this journal, there was, when they studied this, they saw that there are catastrophic human errors occurring in the ART technologies. And it could be wrong sperm, it could be wrong embryo, it could be error in the pre-implantation genetic testings, and it could be malpractice litigations. And as many as 50% though went in favor of the defending IVF clinics, 25% were decided in favor of the plaintiffs. So it was, this paper concluded that there are many common issues involving embryology lab processes, and they can be avoided with increased vigilance, with implementing stringent lab and clinical guidelines. And we should also have a thorough understanding of the specific code processes and the legislation. So informed consent is something which is very, very important, which has to be very clear. It has to be full and informed consent. It is not only assigning a paper. We have to talk to the patient in detail about, we have to disclose the success rate, the risks, the alternatives available, and about the understanding by the patients about long-term consequences, the complications. And these complicated forms need to be told, in fact, one person has to sit down and to explain the complete consent form to the patient in their local language. So we have a precise set of consent forms. Which one has to be filled up? We should all know when we are freezing the embryos, when we are freezing gametes, when we are doing a IUI. So in fact, when it is a ART level 1 clinic, also we should be very thorough with our rules. If we are doing a IUI with husband semen, it has to come in form 7. If it is a donor semen sample, it is 8. So this is a complete list of consent forms that we need to have. So we need to be having this patient record and the gamete donor identities. All of them are being protected by law, but we have to balance the donor anonymity with the offspring's potential right to know their genetic origin. So there are disputes, and the disputes are commonly about the embryo ownership. Now, who has the right to use it? Who can discard it or donate embryos? What do we do after separation, after death? And these legal battles are very common regarding the frozen embryos. So we have to have clear regulations that must govern the duration of the embryo or the gamete storage. And we have this consent form, which clearly says that what you need to, in unforeseen event of the death, the husband has to say what he would like to do with the embryos, to perish, to hand over to his wife, or to be used for research. Similarly, the wife has to also suggest what she would like to do after, in case of any unforeseen event, what she would need to do. This is a very detailed form, and maybe we may not have read it very clearly, but it speaks volumes. The provision of information that it gives is that I hereby, this is the patient also, they should understand that they are coming into a contract with the clinic once they have come into the IVF arrangement. And they here contact the above clinic, at least annually they have to be in touch with the clinic. They have to inform their address, telephone number, email address, their contact details, and failure to contact the clinic for 12 months, or a request to respond to a request for information from the clinic within 3 months will constitute abandonment. And in the event of my failure to comply with these 1 and 2 statements, the clinic has the liberty to discard or destroy the embryos. They are liable to pay fee very on time, and they cannot like just pay and then after once and after 3 years come and say that their embryos were frozen. And now the clinic is not then liable if they did not revert back. So the payment of fee, it is very clear in this form that I'm responsible for the cost of cryopreservation and storage. And I understand that this fee is non-refundable. And should the yearly fee remains unpaid for another year after my invoice is forwarded to my address or I've spoken to telephonically, I'm no longer interested in storing. This is what we can conclude from this. So these are very detailed forms which need to be spoken, and the patient needs to be clearly, he or she should understand in their native or local language what we are trying to, what these forms are trying to tell us. So this was a very interesting Sofia Vergara case. It was a high-profile legal dispute between this actress Sofia and her fiancé Nikolov. Now, they had 2 cryopreserved embryos during their relationship, and this was done in 2013. And there they had created embryos using her eggs and his sperm. And then a written agreement was stipulated that these embryos could only be brought to use with their mutual consent. Now, in 2014, this couple ended their engagement, and the legal action was started by Loeb, the fiancé, in the lawsuit in California, saying that these embryos are live and they need to be implanted and carried to term by a surrogate. So he wants to use these embryos. Now, the Vergara counters her statement, saying that she has the right not to be forced into parenthood against her own will. So she is not willing to use these embryos. So then there was these discussions, and then the case was dismissed because it was California court decided in another way, and the Louisiana case, they said that on behalf, they had no standing. The lawyer did not have any standing to file on behalf of embryos because neither of them were Louisiana residents. So the principle and implication of this is that the couple has a reproductive autonomy, and this highlighted the importance of a written agreement in ART and demonstrated that there is a distinction between the embryo as a property and as a potential life. So counseling is the foremost and the most important thing, whatever we do, ART, non-ART, whatever, OBS, gynae, everything needs a proper counseling. And its role in ART in preventing the medico-legal issues is that not only it supports a patient emotionally and psychologically, but it also serves as a safeguard to the health providers against the medico-legal challenges. So informed consent is something where we have to explain the complete procedure. It has to be in detail about the diagnostic test, how we induce what is fertilization, how we are going to do the embryo transfer, what are the risks that can occur during this process, the risk of OHSS, the risk of multiple pregnancies if multiple embryos are transferred, and the unforeseen events like complications such as selective reduction that may be needed in certain cases, or embryo freezing if the patient is a potential going into hyperstimulation. So these all need to be told to her right from the beginning. A legal and ethical education is very important. The patient should know about the legal aspects, how much duration she can store her embryos, the donor anonymity, the other surrogacy laws. It has to be a proper psychological counseling. The patient has to be prepared for the emotional challenges. And not only that, the financial part has to be very, very clearly told, because Most of the disputes again occur when when they are being asked for money frequently. So they should know about the cost of the procedure, the medication, the additional costs that they may incur whenever freezing has to be done or a frozen embryo transfer. So whatever the hospital policies are, whatever they are charging, it needs to be very clearly and transparently told to them. So this reduces the allegation of negligence. So when we have told them about the risk and complications, the claims of negligence or lack of informed consent is taken care of. Now, the counseling on the likelihood of success helps them manage the unrealistic expectations. It helps them ethical in making a decision, and it addresses their distresses. So, or when we are counseling, we are also documenting. So, a well-documented counseling session, the signed informed consent forms, the patient acknowledgements, all these serve as a legal advice to us, as a legal evidence that this patient had been completely told about what they are going through. And also they should understand their roles and responsibilities. It should be a multidisciplinary counseling session involving the reproductive specialist, the psychologist, legal advisors, financial counselors, and it has to be tailored according to their unique need. Using technology while counseling, providing them also while we are talking to them, making them understand by using interactive apps, by using videos, tapes, it can help them understand this complex ART process. So by this counseling, we are maintaining the records. We are we are counseling them about the disputes over embryo ownership, the multiple pregnancies or the risks of multiple pregnancies. And all these sessions help us in building the confidence between the patient and the doctor. Now, the importance of records keeping is also another very important issue that, in fact, especially the law has told us that the time frame that the records need to be kept, the documentation of consent, the continuity of care, and the compliances of these regulatory compliances set by the local and the international regulatory bodies. What our regulatory body suggests is that all the case records, all the consent forms, the lab results, the microscopic pictures, the sonographic plates, the recommendations and letters all need to be preserved by the ART clinic or depending on ART bank for a period of 10 years from the date of completion of the ART procedure or till the disposal of legal proceedings in case of criminal or legal issues. Now, what are the types of records we need to maintain? Whatever the patient information in case of demography, their medical history, surgical family history, genetic history, the lifestyle factors, the various consent forms, right from the time that they start with the fertility treatment, the ovulation induction, embryo transfer, cryopreservation, and storage of the gametes if we are using donor gametes or if it is a surrogacy arrangement. All these consent forms need to be there in our records. The treatment records, the diagnostic results, the imaging plates, the medications that have been given, the oocyte procedure, when the pickup retrieval was done, the number of follicles, the oocytes retrieved, the method used, how many embryos were created, the embryo transfer documentation, their grade, the transfer date, the technique, everything needs to be there on our records. So if we are clear with our records, I don't think there should be any problems. Cryopreservation records, when the details of the freezing, the unique identification given to that to these frozen vials, because then the mix-up and the things that I'll just highlight are taken care of if they are being done very properly, stepwise. So communication logs, whatever we've spoken to them, the details of the patient communication, their in-person consultation, even if there are emails exchange or any phone calls, all those communication logs and summary of discussions also should be kept in our records. The adverse event reports also should be attached to our files in case there's any complication and the action that has been taken to mitigate these risks and outcomes. So the timelines we should follow, we have to follow the confidentiality, and they needs to be should be following now the digital way or the electronic medical record systems, so as we can streamline the data entry, the retrieval, and we can use the softwares with built-in so as to avoid the duplication errors. So these are the various we should have in the records that I have in brief I've suggested. Now, if there is a oocyte donor and there is some medico-legal complication that occurs, so what are the issues arising here? That one has to have an informed consent when we are using a oocyte, when we in our oocyte donor. The donor has to be informed of all the potential risks, both immediate or long-term. And the consent process, again, has to be thorough, has to be documented, and one should ensure that the donor understands this physical, psychological, and the financial implications. So this is actually being done by the ART bank. So, but still, we as a clinic also, we should have an informed consent signed and kept with us. So if the complication occurs and if the donor says that there was inadequate disclosure of the risk, the clinic or the healthcare provider could face the allegation of an inadequate consent. And the liability may extend to the physician, to the healthcare provider, and then the compensation claims and all may cover not only the medical expense, the lost income, the pain, suffering, and the long-term health impacts. So a breach of duty, if we have failed to monitor the hormone levels adequately or administer appropriate drugs, it could constitute a breach of duty. The donor's medical records have to be confidential as stipulated by the laws, and breach of confidentiality also can lead on to complications. One should follow the laws, and our Act mandates that egg donation should not compromise the donor's health, and it sets strict age and the procedural limits. So we have to comply with our laws. And if suppose a donor experiences ovarian hyperstimulation, have we dealt with this case properly? Have we met with the standard care protocols? So if the donor alleges that insufficient monitoring or the disclosure of risks was done, they can claim they can go on to this, the legal claims may ensue. So the preventive measures are, it has to be a robust screening, medical, psychological, a transparent communication, adherence to protocols, and very, very important now, the insurance coverage. So the intended couple, they say we have to purchase a general health insurance in favor of the oocyte donor for a period of 12 months from an insurance company, and for an amount which is sufficient enough to cover all her expenses for the complications which could arise due to oocyte retrieval. Now, the ART clinic and the banks both have to ensure that the commissioning couple or the woman or the donor are eligible to avail the procedure. So their age limits have to be seen. They have to be, these donors, whether oocyte or the sperm donor, have to come only from the ART bank, and they will test them for HIV, HBs, HCV, and VDRL, and appropriate counseling about the implications, the chances of success, the advantage, disadvantages, the cost of procedure, the side effects, and all should be very, very clearly told to these donors. Now, this was a very recent paper in the very recent Hindustan Times 2024 news, where the High Court discharges 3 city doctors booked for minor egg donors' death. So this was a very long back case where the Bombay High Court discharged these 3 doctors who were booked for death by negligence of a minor girl who they were using as an egg donor. And this was a teenage girl who died on August 10 after donating her eggs for the 3rd time on August 8, 2010. So one has to be very, very careful. The age limits for the semen donors, 21 to 55, for the oocyte donors, 23 to 35, and only once they can donate. And we should not overstimulate them, because they say that not more than 7 oocytes should be retrieved, but it is now just that it should be a safe stimulation for these donors. Now, how to prevent mix-up of the embryos or the mix-up of the semen sample in the embryology lab? One has to follow strict identification protocols. Double verification system is very robust. Use a dual check system where at least 2 staff members verify the identity of the patient and the sample. The label should be very clear on these samples, the name, unique ID number, and one can even do bar scanning and use RFID tags. Now, in the preventing the lab workflow management should be done. So as you have designated workspaces, you have separate workspaces handling the different samples to avoid cross-contamination and ensure that only one patient sample is processed in one specific area at a time. Or you can use color-coded tubes, containers, and lids to differentiate the samples. Documentation has to be very, very comprehensive, and using advanced technology, electronic witnessing system, or a biometric verification. And these days, AI monitoring is coming into picture and into vogue. Staff training, we need to do a regular training so that they can understand that these cases, the staff needs to be trained on sample handling, the identification protocols, the use case studies of the mix-up to emphasize the importance of vigilance. And you can do simulation drills, mock scenarios can be created, and see how the staff responds. External audits, one can use third-party auditors to evaluate our lab protocols and compliance, and one should follow the accreditation standards. Now, error reporting should be done immediately, and you should establish a culture where staff can report these potential errors without fear and find out the root cause, how it happened, why it happened, and you then close the loop by this investigation that you are doing. So a continuous improvement needs to be done, and you should have clear plan for identifying and resolving the mix-ups before the samples are used, and ensure immediate communication with the patients and adhere to the national and international guidelines. Now, while storing the gametes and preventing the storage accidents of embryos or gametes in the lab, now these, you should have cryocans which are fitted with local alarms, which should have an adequate storage capacity, and which should have a on-call system, but should have an adequate staff where there is an on-call system where they can respond to the alarms out of working hours. There should be emergency backup plan, and the future fertility, where there is a future fertility impaired because of a medical condition. These patients, the samples should be put into separate storage vessels, and they can be stored for a duration longer than 10 years after taking permission from the national board in certain specific cases. Now, again, how to prevent these storage accidents is by using high quality cryo storage tanks which are certified. Maintain strict separation between the various categories, and use backup storage tanks to minimize risk during equipment failure. Ensure duplicate systems. Do regular maintenance, regular inspections, regular maintenance of cryo tanks, refrigerators, and replace old equipments. Do a proper monitoring system so that you know the temperatures are being maintained. Include alarm systems, and install audible and visual alarms. Always have a power supply, a UPS or a backup generator, and do a barcoding, have a digital inventory management, witnessing, double verification, so as you can prevent all these accidents. A regular staff training and a disaster recovery plan, and develop a comprehensive plan for emergencies like equipment failure or a disaster plans. So routine inspection, quality assurance check, incidence reporting, third-party quality control, transparent communication policy and technological advancements with the ethical and legal oversights is something which can help us, all of us. Again, multiple pregnancies and having medico-legal implications due to multiple pregnancies, one should have a risk disclosure and an informed consent. Disclose these patients that because of multiple pregnancies, there are maternal complications, there could be neonatal risks and complications, and these needs to be documented, signed by the patient that they understand. And that is why if we are doing 2 or 3 embryos are being transferred, the patient should understand that though it is our country in various legal and ethical standards do suggest a single embryo transfer being recommended to avoid such risks. Now, improper embryo transfer decision, transferring more than embryos that are necessary, leading on to higher order pregnancies, poor monitoring during ovulation, induction and stimulation, resulting in multiple ovulation. So the patients can sort of put in a negligence or a malpractice claims if not properly advised and told to them. The maternal health, fetal health risks, they also may have to undergo selective reduction in case there are advanced multiple pregnancy, multiple order, triple or quadruplets, if more embryos have been transferred due to any reason. So a selective reduction may need to be told to them that this is a very ethically sensitive and a legally fraught decision that may need to take. And suppose if it is a surrogate, again, this is a very delicate sort of a decision, which who will take that decision, whether the surrogate can do that, take that decision, all needs to be spoken and very clarified. Now, the emotional and financial impact there is a lot of psychological stress, and because of the patients may claim a psychological harm due to inadequate counseling and due to risk of multiple pregnancy. Not to forget the financial burden because of multiple pregnancies. So one has to be follow the accreditation standards which have been set up by our country, and the preventive measures is a proper protocol adherence and a protocol and proper monitorings. So the parentage and legal custodies also have to be very clearly defined. And also posthumous reproduction is something, one slide I have added here. For the posthumous fatherhood with peripartum surgical sperm retrieval. So we can only do it once, only if we have a prior consent of the commissioning couple, which is available on a specific affidavit. Then only we can do. Then cross-border ART issues can, because of the medical tourism, patients often seek ART in countries and the laws are different in different countries. So one has to understand the laws very clearly, what our country suggests. So there could be liability, malpractice issues, there are social ethical issues, and therefore there is a need for regulation, there is a need for standardization. And we have the regulatory bodies. Previously, we had the ICMR, and now we have the complete, we have our law that we have to follow it very religiously and with a lot of ethical and moral. There are, though some individuals, some groups do oppose the ART procedures. They are against embryo freezing, third-party reproduction. But to balance it, there are patients who say that they have right to access to services. So laws are important, but they can only be effective if the people know about the particular laws. We as doctors are also very clear about what we are doing and how we are doing. And if we do it very clearly, I don't think we should be scared of the laws. Thank you so much, ma'am.